Hello, everyone, and welcome to Health Law Talk presented by Shahardy Sherman Williams. Before we get started, please be sure to subscribe to our podcast and follow us on Facebook, Twitter, LinkedIn, and YouTube, linked in the description below. We hope you enjoy this episode.
Good day, everybody. This is Conrad Meyer here in the studio today with Rory Bellina and Chris Martin for another episode of Health Law Talk. Good morning, guys. How y'all doing?
Morning, Chris.
Good morning.
All right. So today, again, very interesting topic today. We're looking at the vaccine mandates, COVID vaccine mandates. Lots of confusion, honestly, from clients, from people we're talking to in terms of what's out there, what mandates are out there, the federal mandate, the OSHA private mandate. Now we have this CMS mandate. Where hopefully all of us are going to clear that up today. What do y'all think about that, guys?
Yeah, like Conrad mentioned, last week's episode was on the private employer mandate. That was kind of part one of this three-part series. Today is going to be on the CMS, we'll call it the CMS healthcare worker mandate, just for this discussion, and then we'll wrap this up with the federal employees. But before we jump into today's topic, part two, the CMS healthcare mandate, Chris is going to give us a little bit of update. It's only been a week since we recorded our last one on the private employer, but the courts have been blowing and going on this already in a week, Chris. So, Chris, what's going on since our last one on the private employer? And just to recap, that is 100 or more employees, and we went into detail in last week's podcast. So please listen to that. But give us a brief snippet. If someone didn't listen to last week's, what's the private employer and what's been going on in the courts in the past week?
Where are we now?
So last week, the Fifth Circuit Federal Court of Appeals had granted a temporary restraining order, 3-judge panel, and then briefs were due to determine whether their permanent injunction should be implemented. And we got an opinion just the other day from Judge Engelhardt, former district court judge in the Eastern District, and he wrote a pretty scathing 15 or so page opinion, 20-page opinion, upholding the restraining order and entering a permanent injunction. And at the last line of the order, I'll just read it. It is further ordered that OSHA take no steps to implement or enforce the mandate until further court order.
And this one is private employers. So we're not talking about healthcare workers. We're talking about the one that we did our episode last week, 100 or more employees, and we went through the tests. And that's the one where if you weren't vaccinated, you'd have to get weekly testing. You'd have to wear a mask. That one is the one where you'd have to track it, $13,000, I believe it was, per violation, per person. So that has been stayed. And then, correct me if I'm wrong, that is now that there was a lottery system and the Sixth Circuit is going to hear this one?
Yes, the Sixth Circuit Court of Appeals in Cincinnati, Ohio, will now hear the next step in this process. I think every single federal appeals court had suits pending. They do a lottery system where they literally pick a ball out of a basket, and the Sixth Circuit was picked. Interestingly, the Sixth Circuit, from what I understand, is one of the more conservative Republican judge courts of appeals. So it'll be interesting to see what they do.
And if they uphold the Fifth Circuit, then do you predict that that the government will step in and challenge us to the Supreme Court?
I think so. I think we're headed to the U.S. Supreme Court on the OSHA private employer mandate.
Yeah, no doubt. This is going all the way up.
So that's a really great recap of last week's episode and where that stands. And before we get into the details of today's CMS one, where does this one stand in the courts? Because I know that I believe there's a numerous amount of states that are challenging this one.
Well, yes, and it has some Louisiana flavor to it because just recently, yesterday or the day before, 12 states, 10 states, 10 southern states, 10 Republican states filed suit in federal court in the Western District of Louisiana in Monroe. And our own Attorney General Jeff Landry is going to be leading the lawsuit to have that mandate stayed and eventually, hopefully, overturned.
This is the CMS mandate.
This is the CMS mandate that they feel is exceeds CMS's authority, and as they're seeking court intervention to halt it or overturn it.
So as of right now, the CMS one is still active per se, but we expect these legal challenges going on. So I think let's jump right in and let's presume, like we did for last week's episode, that this one will be in effect. But we want to give our listeners kind of a summary of what's going on, because this affects the vast majority of healthcare providers. So, Conrad, you want to kind of kick it off and give us a little bit of flavor on what this is trying to accomplish, and just jump right in.
So basically, the CMS mandate requires that various healthcare workers, extenders, contractors who provide services in a healthcare setting, and when we say healthcare setting, I mean there's a laundry list of different settings that CMS has listed that it will cover. Must have the first dose of the 2-dose FDA approved or a single dose FDA approved vaccine by December the 5th of this year, and they must be fully vaccinated by January 4th of 2022. So, and if they're not in compliance, the facility itself is looking at potential civil monetary penalties, possible exclusion from Medicare and Medicaid. And they're going to be doing this through state surveys. So they're going to use the local state, like Louisiana Department of Health, to help and assist with the surveys of the various facilities to ensure compliance. And
you mentioned something important that I just wanted to highlight on. You said fully vaccinated by January 4th. I know there's some confusion on what that means. Does that mean that you received the shot by that date, or is it 2 weeks? I believe the policy is that you're not fully vaccinated until weeks after that last shot. And CMS clarified that, didn't they? And they say that as long as you have received, because the times didn't work out from when the policy started to end it. So as just for our listeners to be clear, as long as your workers have received the second or the first, if it's Johnson & Johnson, by January 4th, that's considered in compliance.
Right, because you had that 2-week wait post-shot for the efficacy to build up. And so the timeline on the original rule didn't work out, so they needed some clarification on that. So You're correct.
One minor point, because I think when CMS drafted this rule, somebody didn't look at the calendar, because December the 5th is actually a Sunday.
Oh, geez.
So
okay.
that same guidance said, no, we're going to do it. It's now actually December the 6th.
On the Monday.
Yeah.
Gotcha. So who does this apply to? Let's start with that, just how we did our last episode. Who does this apply to? And we'll walk through all the details.
You want me to do that?
Yeah.
So, CMS is doing this under their power to set conditions of participation, which has very broad powers.
Walk people through what that means, because a lot of people do not understand what conditions of participation is. So give the listeners some idea what that means.
So, in other words, to be eligible to bill and collect from Medicare and Medicaid, hospitals, ambulatory surgery centers, and there are 15 or 20 other types of providers have to meet certain conditions in order to be eligible and accepted by Medicare and Medicaid to bill them and then to collect. So we're talking about billions and billions of dollars a year if you're participating in Medicare and Medicaid. Right. So it's a big financial deal.
Right.
So some of the list of you mentioned if you are enrolled in Medicare and part of the conditions of participation is that this applies. So let's talk about covered facilities and some that aren't covered. I think that's important, because I think the goal of this, similar to the private employer mandate of 100 and more, is that CMS wanted to capture as many facilities as they could. So, Conrad, do you want to kind of explain to our listeners who these covered facilities are and maybe who they're not?
Yeah, sure. So, Rory, you're looking at, again, this is such a broad brush. You're looking at the shotgun approach, or as the Fifth Circuit would term, Chris, the sledgehammer approach, right?
Right.
So, ambulatory surgery centers, hospitals, hospices, the psychiatric resident treatment facilities, LTCs, long-term care facilities, immediate care facilities, home health, community mental health centers, outpatient rehab, any clinic, any rehab, home infusion, RHCs or rural health clinics, FQHCs, federal qualified health care centers, health centers and ESRD or end-stage renal disease facilities. So, I mean, a broad, huge brush here from CMS.
And when I look at this list, I try to figure out, okay, what were they trying to accomplish? To me, it looks like they're trying to capture facilities where there's a lot of interaction between providers and patients. Is that what you think the intent was here, Chris?
That's right. That's right. So any staff member of any of these listed entities that Conrad just enumerated, any staff member on site, no matter what their job is, if they provide patient care or treatment or come into contact with somebody who does, they're covered.
So imagine who that is, though. Imagine, I mean, when you think about the hospital, because I know you've walked the floors many times, and I have, and we all walk in a facility. That's environmental, dietary,
food,
the food.
Right.
What about the lady in the bookstore? I mean, the gift shop. So what about the parking attendant who basically takes the money from someone parking in the parking lot? Those people interact with patients all day long. So, I mean, when you start really thinking about it, Chris, I mean, it covers a lot.
It is very broad.
And the rule specifically stated it applies to employees, licensed practitioners, trainees, students, volunteers, and a big one on this one is contractors who provide care, treatment, and other services, and who have contact with other individuals who are also covered. So I think that's very interesting. They went into the notes and comments and said some of the vendors that come in that maybe do periodic service or that kind of thing at the facilities it won't fall into this. But the big goal that CMS looked at for this is how often you're entering the facility, contact with other individuals, safety measures, and use of the shared common area. So I think this captures a lot of people. One thing that I thought was very interesting that it didn't, and I'd love to hear, Conrad, your thoughts, is that this doesn't apply to physician offices.
Well, that, and I was, as you were reading that list, I'll touch that, but I was thinking about materials management, I mean, those guys just literally drop off truckloads of supplies in the back. Are they going to get hit? The trucking guys. So, but you're correct to your point, Rory, on the physician side. No, nothing. I think when you're talking about MOB, physicians in that, I mean, I think they're going to get hit too.
Yeah, because it says that in the guidance that it will apply to people that are provider based, like outpatient departments and PT, speech. OT.
Remember how a long time ago they were all doing this new deal on outpatient on the hospital based, right, to reach out to the broad swath to capture that type of revenue stream. Well, now all that work and all those outreaches to now all those hospital based type practices are now going to be in this path.
And Chris, I think one thing that's important to note is that if you're a physician office, let's say you're a pediatrician,
right.
Okay? You've got your solo practice or your group practice. You don't fall under this. But if you've got privileges and you go do well visits on newborns or something like that, then you could fall under the hospital where you've got privileges, right?
That's right. That's right. Because to have medical staff privileges at a hospital, you're going to be covered under this mandate.
So I'm trying to think of people that aren't included in this, and it's very limited. It would be physicians that don't have privileges that are strictly in their office. But I mean, if they've got privileges to do surgery somewhere, Conrad, they're included. I mean, it's going to be hard.
There is an out though, because I mean, if you read the rules in the FAQ, it was anyone who doesn't do individuals who infrequently provide ad hoc care or non-healthcare service. Non-healthcare. What is that?
Right.
And that's the gray area, right? And how do we define that? Of course, it's not defined. I mean, how are we going to define that?
Sure.
And it does, telehealth's been a real hot topic during COVID. And
right.
It does carve out, if you're doing purely 100% telehealth or telemedicine, which is, you're talking to a patient remotely,
right.
Then you can be excluded from this.
Well, that makes sense. I mean, I could see that point. But then this whole gray area of infrequent non-healthcare related interaction.
Sure.
What is that?
So we're saying, in a traditional hospital, it's pretty much everyone there. Minus a few provider-based. There's some exclusions, but if you're on a medical staff, it could be that. So it seems the goal is to capture as many people as possible. I'm going to go back to our private employer one where we had some exemptions. What are the exemptions here?
Well, I mean, back to the same thing with the private. You're going to have medical exemptions and religious exemptions, and we've gotten calls. I mean, you and I have talked about this, Rory, in
Yes.
a previous episode. We're getting calls from medical providers who have legitimate, in our eyes, medical exemptions from treating physicians who say, "Oh, you have a clotting disorder. I'm not recommending you get this vaccine. Oh, you had COVID before. You've had a positive antibody test. I'm not recommending you get the vaccine." And so I don't know. There's been a lot of discussion about how that is presented, how that is reviewed, and by who. And is there some sort of an appeal process if you don't like the decision?
And Chris, I know you looked into this as well because you've had some questions about it. Let's use the example of a nurse. If a nurse believes that they have a medical exemption, what's the process that they have to go through?
So interestingly, the CMS mandate goes into some detail about how the form and the requirements and the hoops that the employee has to jump through to even make the request. Mm-hmm. So they have to basically get the proverbial note from the doctor. They have to, and the doctor has some very specific requirements. The doctor has to identify the particular vaccine that's at issue, whether it's Pfizer, Moderna, or Johnson & Johnson. They then have to specifically say what's the medical contraindication for that particular vaccine and write out a written statement, an opinion as to why this particular employee should be exempted from the requirements based on recognized clinical contraindications. So it's not simply fill out a form, say I'm allergic to blank.
Right.
Here's my medical exemption. The employee has to interact with his or her provider who is qualified in that area. And if it's a physician who's submitting the exemption, he or she can't be the qualified provider. They have to use somebody else.
Okay, so I got to ask this question, guys. Okay, I'm sorry, I got to ask it. How much do you guys think politics are going to play in for the physicians or providers who are writing these medical exemptions for their provider patients, if you will, if those physicians also have privileges at the facility that their patients are seeking exemption from? What do you think? Do you honestly believe that this is going to be a transparent process, or do you think there will be some pushback?
My concern, and from what I've already heard, and we had a client contact us yesterday about this, is what's going to happen if your best scrub tech or your best nurse says, "Look, I need a medical exemption, or I'm walking out." And they go to
that's not an if, that's actually happening.
Sure. So, does the doctor provide it? I mean, it has to be very objective criteria that Chris just discussed, but I think that is going to be a concern, and there's going to be some
But
some
what
loss.
about what I'm talking about is there some panel of individuals or an individual who is going to be receiving these requests, and as outlined in the CMS thing, that you're going to have to track compliance with this anyway. So my question is let's just say that I'm the provider writing the exemption for other providers, yet I am submitting these exemptions to a hospital within which I also have privileges. And let's say that there's some people in that hospital that have very strong beliefs, because we've seen this before, very strong beliefs on pro-vaccine and anti-vaccine, right? Is there going to be politics played against me as the physician? Am I going to get a call from the administrator or the board or someone else saying, why are you writing all these medical exemptions? Do you think that is going to play into this, or do you think it's just going to be very transparent? I mean, this is just personal opinion. I'm just asking you guys.
Well, it's supposed to be transparent.
Of course. I mean, that's the rule.
I think it's going to vary from facility to facility.
Agree with you there. Yeah.
And one of the practical takeaways from this vaccine mandate is the recommendation that you use the same person or the same panel to make these decisions, so that they're at least consistent.
Agreed.
So you don't.
That's another thing, though. Is there some compliance, and I didn't see it, maybe you guys did, if y'all seen anything, is there something that requires a panel, or is it left up to the facilities? Is there an appeal? So it's facility specific, my understanding.
Yeah, there is. They don't talk about who has to be on the panel or how the decision is made, but they do say it has to be a legitimate, consistent process, and it has to withhold scrutiny if that state surveyor comes in and says, I want to see, patient X's file and how you made the decision to grant the medical exemption.
And I thought something that was very interesting that I wanted to bring up is one of the comments or the FAQs was that one of the criteria should not be revenue from that provider. So let's say your top neurosurgeon requests a medical exemption and you grant it, but one of your shift workers requests one and you don't. If it's the same exemption and the same request based on the same medical basis, and you grant it to your number one neurosurgeon who's billing and collecting as a huge revenue source for your hospital, but not one of your staff workers, you're going to have a problem there.
So 2 questions here. Have we just created a new special group under Title VII, right? Have we just now created that? And 2, do facility, as far as from all of us, because all of us have a lot of collective experience in various areas in facilities, right? So have we just created a new compliance department within compliance?
Chris and I went into a huge detail with this last week on the private employer that I think this is going to be a full-time job for someone to track.
This is not a part-time thing, and I think anybody in compliance would agree that this is going to swallow someone up.
Well, and Rory and I were on the phone with an HR director earlier this week or last week, and she went from, I don't know and I don't want to know about the vaccination status of my 350 employees to, we told her, you're not only going to have to know.
Oh, yeah.
You're going to have to keep track of it every week. You're going to have to, it's going to be a dynamic process. You have to ask questions. You're going to now be storing and collecting and storing medical records for each employee.
The interesting thing now, this CMS exemption, different than a little bit than maybe correct me if I'm wrong, but there's no test. There's no either or. So you either
Correct.
Vaccine or nothing. So you can't go in and say, "Oh, I have a negative PCR test this week," right?
And that's one of the criticisms in the lawsuits filed challenging the CMS mandate is it's jabs or jobs.
Correct.
I like that. Yeah.
That's the phrase they use.
Do you know, and I don't know if this happened, but this is a pivot for a second. But I heard, and I don't know if this is true, but I heard that the FDA has sealed the records on the COVID vaccine testing. In other words, all the tests they run to get full approval. I've heard those have been sealed. I can't believe that. I don't. Have y'all haven't heard anything?
I'm unsure. I'm unsure about that.
And I just throw that out there because I heard it last night, and I'm like, this doesn't make any sense. But
I checked.
A lot of this doesn't make sense.
I checked the FDA website yesterday to get a list of FDA approved COVID vaccine, COVID tests, diagnostic tests.
Okay,
and there are 269.
Oh wow!
Approved. FDA diagnostic tests.
Gee, wow.
One other thing, going back to the medical exemptions that I found was very interesting is the question was brought up, or the phrase, if you have a medical exemption, is that a permanent exemption? And CMS says, no, it's not. So if, let's say, you're undergoing some sort of therapeutic or treatment, chemotherapy, something like that, that's a contraindication for this vaccine. Mm-hmm. But CMS says if you stop that, then you're back into as Chris said, the jabs or jobs. So where you could then be required to do it. So going back to
the compliance,
and HR, that's going to be something where.
How do you monitor that?
That's a great question. It's a great question.
Are you going to ask your employee, well, how's that chemo going? Can you tell me when you're rolling off your next cycle?
Yeah, I think it's going to be a big monitoring thing, and it's going to be comparing to the private employer one.
Right.
It's going to be a lot to do as opposed to just getting the weekly testing and wearing a mask. This is going to be.
Well, imagine tracking that though, Rory.
Yeah.
I know they have. We all know they have software to track vendor contracts. We've seen that.
Mm-hmm.
Sure.
A vendor contract type of software to manage that. But how do you manage people in terms of that?
Sure.
People's health status on a week-to-week basis.
Right.
Now, our second exemption, religious exemption.
Yes.
It's here. Let's talk a little bit about that.
Sure. Again, the second exemption is the religious exemption, and basically it's saying to follow EEOC guidance. And interestingly, I thought was really good was you can't look at it It's a strongly held belief, right? And you have to document it, and the person receiving the exemption can't interpose their own feelings. Remember, it's got to be what is the belief of the person who is submitting the exemption. It's in their eyes in terms of the strongly held belief of it. Is that correct?
That's right.
Is that how y'all read that?
Yeah,
that is how I read that.
The phrase they use is sincerely, a sincere, strongly held religious belief, observance, or practice.
And so I switched over and looked at the EEOC guidance on religious exemption, and it said that if the employer reasonably needs more information, the employer and applicant should discuss, and the applicant may need to explain the religious nature of the belief, observance, and practice. So again, going back to managing this and going back, I think medical exemptions are probably easier than religious exemptions. I mean, you as an administrator or someone in HR, Chris, I mean, they might be calling in people to discuss religion. I haven't heard of that before.
Yeah, at least the medical exemption, it's a lot more objective. There are clinical contraindications that are listed.
True.
Religious exemption is based on the applicant's own religious belief. It's very subjective.
And Chris, I think you mentioned earlier, if you Google, religious exemption letters right now, I think you can find, hundreds online. So, I mean, this has already been tackled by some people, but...
Yeah, there was a lawsuit in New York by the St. Thomas More Society, and they've posted their letters, their religious exemption letters on the internet
for people to use.
For people to use, right? But that's more of a gray area because then you're really getting into Title VII issues.
Yeah.
If you cross that line, so I guess that my question is if we look at it from the view of the employers or the facilities, right? What's the bright line here? I mean, we obviously don't want to get hit with a fine. We obviously don't want to be excluded. So do we just have to collect documentation to show this? And what about audio? Do I have to prove this to a surveyor now?
Well, I mean, yes, you're going to have to. Documentation is going to be critical. And remember, too, these are accommodations. The medical exemption is under the Americans with Disabilities Act.
Right.
So you handle it like a disability claim. Just because somebody may be exempt from having to take the vaccine, the employer could certainly still say you need to be tested weekly. You need to wear a face covering whenever you're indoors.
That's a lot of power for somebody.
And those are what the recommended accommodations are. CMS didn't say what they were going to be. They basically said, like you said, the jab or job phrase, get your vaccine or there's going to be issues. CMS didn't say what would be required like OSHA did. OSHA was very clear and said at least weekly. They went into every scenario possible on when you had to be tested if you didn't show up for testing, what the violations would be, the masking, where you had to mask, what kind of mask. CMS just said that that facilities have to develop a process for implementing additional precautions for staff who are not vaccinated. So that's going to include testing, distancing, social control. The goal is to minimize that transmission, but that might turn into something where you've got, I know most hospitals do this for flu, and I've seen some of them do it where they put on their badge, 2021 flu.
Right.
Well, I think it's gonna turn into, okay, well, so-and-so isn't vaccinated, so they're not going to get this special sticker, and it's going to be very easy to know who those people are that are not vaccinated, and that it kind of invades a little bit more into their privacy.
Think of the cost now that they're going to be borne by facilities for trying to implement something like this. There's no guidance, right? So it's going to be facility specific, like Rory said. Think of the cost factor in some larger systems. I mean, I just think it's going to another additional cost borne by the facility.
Well, and the interesting thing too about the CMS mandate, vaccine mandate, is under the OSHA mandate, it's a temporary measure. It's supposed to end in 6 months. The CMS mandate has no end date, so my theory is it could continue until the public health emergency ends, which could be a while.
And at that point, the hospitals could voluntarily adopt it as something for them to continue on.
But wait, is it tied to the PHE?
It's not, but I'm just thinking logically it makes sense that it would. But there's no end date to the CMS mandate.
Is this going to be written like our physician fee schedule or other type of fee schedules or the inpatient prospectus payments, the regs on those. So is this a regulation now? So it is not tied to PHE. So once it's passed, it's a final rule, and that means, to your point, in perpetuity now.
Could be. I think it's called an interim final rule right now. But my point is there's no end date like there is for the OSHA private employer mandate.
And the enforcement on this is pretty serious. It talks about using state survey agencies. So here that would be Louisiana Department of Health or different, or if they would source that out. But they're allowed to come in and do compliance reviews for recertification and complaints. I think complaints is going to be a big one. It might be a little bit more easier to manage in a small 100 or more private workplace, but when you're working in a hospital, there are some people that are for these, and there's some people that aren't, and everyone can have their beliefs on that. But I think there's definitely going to be cases where if a hospital doesn't follow this very strictly, there's going to be complaints, and there's real dollars at stake here.
How about actual access to care? Because from my understanding is, and I don't know if y'all have heard this, but for example, a lot of rural hospitals in our rural hospital system, some of them have told, I've heard, the administrators have said, if I enforce this, I will have no nurses.
Sure.
If I enforce this, I have to close a med-surg floor, or I can't staff my ICU, or even my ER. So, this is not just a financial thing or a compliance thing for these hospitals. This is, can I open my doors if I enforce this? Have y'all heard the same thing?
Not only have we heard it, we've read it in the first lawsuit that was filed by a number of rural states against CMS and the government. That's one of their arguments is exactly that, Conrad, that if we have to enforce this vaccine mandate, we are going to continue to experience critical healthcare worker shortages to the point where we're not going to be able to provide the standard of care that the community is used to.
And just to piggyback on that, I had a call with a practice earlier this week who discussed that. I was explaining to them these procedures, and they said, well, if this is the case, then we're just going to opt out of Medicare, and we're going to end our contract, and we won't take it anymore, because if we enforce this, we're not going to have enough people to work. Their practice was so anti-vax per se that the doors would have closed. They would have no providers. They would have had no support staff. So they were going back, and they were going to have meetings and discuss it, but talk about possibly opting out of Medicare because of these requirements.
So let me ask you this, guys. So I understand the premise of this. We all do. We've seen it over the last year and a half, really year, if you will, from the vaccine's inception. My question is personal opinion. Do you think that this was something that CMS did on a hastily basis, simply because they heard the president speak like OSHA and immediately came out with this? In other words, my personal opinion is I don't think this was carefully thought through in terms of the guidance and how fast it came out. We have a quick trigger. We got a low, quick time, not a lot of time for comments and discussion for obvious reasons. I understand that. But just curious, what do y'all think about that? Do you think this is, and if you disagree, I totally understand. I just think it's, did they take into account the rural hospital issue? Most of these people in rural America have very strong beliefs against the vaccine. If you look at the data just from the news media, you can kind of see where the anti-vax is coming from. And a lot of that's in rural Midwestern America in the South. And so, they're the ones that are going to have the issue with access to care issue. Do you think it was a rush to judgment?
I think CMS, it's interesting, in the rule, they spend like 2 lines on that issue. And, they say, we've heard that implementing this vaccine mandate could have an adverse effect on jobs. The next sentence is, but we don't have enough evidence to support that. What my thing is, I think with the CMS vaccine is CMS has broad authority to establish conditions of participation. Mm-hmm. So I could easily see a court upholding the CMS vaccine under that they haven't exceeded, that CMS has not exceeded their authority, as opposed to the OSHA vaccine, where at least the Fifth Circuit feels very strongly that OSHA far exceeded its authority.
Right.
When I think about it, I think that the administration, obviously CMS is run by an appointee of the president. I think this administration really looked at probably what's our biggest employer in the United States. And I think healthcare is probably the biggest employer per se. And I would say when you drop down from that, the majority of healthcare providers take Medicare. They're enrolled in CMS. And so I think this was the low-hanging fruit to get a big jump or a big push for more Americans to get vaccinated. And I think that was the intent. I think the administration looked at what can we do to get more people vaccinated for whatever reason it may be. There's so many reasons. And I think they saw healthcare is the number one industry right now in the United States, and 90, I don't know what the percentage is, but I know it's in the 90s, participate in Medicare. And so let's put it into that. Let's make it a condition of participation, just like you have to have X amount of fire extinguishers and this wide of doorways. And, we'll squeeze it into there, and that's going to give a shot in the arm, for lack of a better expression, for our vaccination numbers.
That was a good expression, Rory.
I didn't mean it to be that close.
A lot of you jab or job.
Yep. And there's a lot of issues that could go into this if you don't comply. I mean, there's obviously the CMPs, civil monetary penalties.
Well, for our listeners, they don't know what that means. What is this? Can you explain to the listeners what is a civil monetary penalty?
Sure. So that'd be a penalty imposed by I think it technically falls under OIG, but it's a penalty imposed for not complying with the conditions of participation.
And it's a fine, usually.
Correct.
In per instance.
Correct. Which could get very high very quickly.
Now, interesting. Will they count each individual employee or person as the instance?
I think they very well can. OSHA is, so I don't see why CMS wouldn't.
CMS also has a simple remedy to just deny the claim.
Sure.
Start denying, quit paying claims.
Or they'll terminate you.
In addition to the CMP.
Right.
Sure.
Wow.
So they'll cut off your revenue source, and you're kind of forced at that point to make a decision.
Not only are you forced, if you don't do it, based on your payer mix, you could be in a real trouble if you have denial of payment, or even worse, you terminate it from the program itself.
Now, Chris, one thing that we talked about after the show last week, but I think it's important now because we've gone over the basics of the private employer and we've gone over the basics of the CMS, healthcare workers. There's a little bit of overlap, but there's some clear guidance on one doesn't apply to the other. And I know you wanted to talk about that, so I think that'd be a good time.
Yeah. So the order, if you are covered under the CMS mandate, then that's the one that trumps you. And that's the first priority. So a hospital that has over 100 private employees would not have to comply with the OSHA mandate because it already has to comply with the CMS mandate. So the ranking is CMS mandate first, OSHA mandate second, and then the federal employer contractor mandate third.
I see. Thank you for clarifying that, because that I know a lot of people probably were confused with that. So if you're subject to CMS, then the OSHA rule does not apply to you.
Well, I'm curious, from enforcement to compliance. I'm just thinking in my head of all of the boxes that need to be checked now from a Medicare participating provider now to comply with this, and I don't know how they. Some people, I don't know how they're going to do it. I really don't know. They're going to have to really go into high gear very quickly.
That's right.
Very quickly.
And I don't think that our clients should be lulled into thinking that the courts are going to save them, because right now, there's been 2 court challenges to the CMS vaccine. There hasn't been a temporary restraining order entered, and as we sit here today on November the 18th,
right,
it's enforced. And so you need to have a good written COVID vaccine policy. You've got to have a process for vaccinating all your staff. You have to have a process and a plan for handling these exemptions, And you have to have a process and a plan for tracking and documenting the vaccination status of all your employees. So, to your point, Conrad, it is a staggering amount of work
in a short period of time.
Yes,
and especially Chris, because you work for a large system. So, I mean, you to make that kind of a change system wide in this time frame, it's like trying to climb Mount Everest, I would say.
Well, the big health systems will be able to do it, I think.
Well, because they have the personnel to do it.
It's the physician-owned
right.
facilities. It's the smaller facilities that I think this is really going to
and I think
impact as well.
What's confusing and what people should continue to monitor, like you mentioned, Chris, if CMS applies to you, you don't need to comply with the other mandates. But if the CMS healthcare does not apply to you, but you have more than 100, then OSHA applies to you. So what if we get to the situation where, and I don't expect this to happen, but I guess it could, where the CMS one is stayed, but then the private employer one is kicked back in place. You might be kicked back over to that one. So there's more than one bite at the apple for the government to enforce these regulations. And so what I'm telling people, and some of them are more hesitant now that it's been stayed more permanently. We're still advising people to get, especially our healthcare clients, to get prepared for this one way or another, because the government has now, they kind of get two bites at the apple on this. And so I think it's important for people to continue to put into a plan. They might not want to because they know that this litigation is going to go on, and they're hopeful that this doesn't go into effect. But I mean, Conrad, what are you telling people if they're kind of hesitant to put in all these procedures in place because they don't know what it might be worthless if they do it and then it goes away?
I think you got to prepare for what's right now, and if you're going to be subject to it right now, then you need to prepare for it right now. Otherwise, you're opening yourself up to exposure for the penalties, the fines, and removal from the program.
And we don't know if the stay is overturned or if the Supreme Court holds against it. With the flip of a switch, everything could go back into full enforcement immediately.
I just have one question for both of you guys. Just one. Actually, really one word. You ready? Boosters. I mean, no one's talked about that. That hasn't been mentioned in OSHA. That hasn't been mentioned in CMS. So what's good? Because I just saw the other day that LDH here is recommending boosters. And it's coming. It's coming. So where does that fit in?
So right now, there's no requirement under any of the mandates to have a booster shot.
Right. But
as we sit here today.
But it could be changed to where
could be a big but in that.
Sure.
Right.
They could change the definition for fully vaccinated to mean your first two plus.
Now I know Australia did this.
Yes, your first two plus a booster within 6 months of your second, or if it's Johnson & Johnson, of your first.
And just to be fair, Australia did this. What they said was that you would not be considered fully vaccinated unless you had your booster. So when are we going to cross that bridge?
Stay tuned.
Stay tuned. I mean, this is a moving target, guys. It really is.
So to kind of summarize, we've gone over now private employers. We've now gone over CMS with healthcare. And next week we'll wrap up this 3-part series, and that's going to be with federal contractors and employees, which, a little bit smaller of a bucket. We've kind of approached them in terms of who does this affect the most. But,
right.
That one's going to affect people, and that one's got some special rules and regulations as well.
Yeah. I mean, again, back to when ACA came in effect, remember we said that the plans, remember that when President Obama says, you'll be able to keep your plan, right? We call them the grandfather plans, right? But really, when this whole thing was set up, it was set to eliminate all those, and they have pretty much. So this, in my mind, it's the similar situation. All of these regulatory schemes from OSHA, CMS, from the government are going to eventually, it puts you in a situation where everyone's going to have to get it. I mean, that's my personal opinion.
I think we're heading that way.
Yeah.
I agree.
Yeah. Good show, guys. Yep, we're going to do that now. So, look, everybody, we're going to wrap up the show. This was great, part 2 of our series on the COVID mandates, and this one was the CMS conditions of participation mandate. Please leave your comments in the comments section on Anchor and let us know what you think about the show today and any suggested topics. We really appreciate that. But until next time for part 3, everyone have a great holiday and enjoy the week. Y'all take care.
Thank you for listening to Health Law Talk presented by Shahardy Sherman Williams. For more information or to contact us, please visit our website linked in the description below. Also, please be sure to subscribe to our podcast and follow us on Facebook, Twitter, LinkedIn, and YouTube linked in the description below. Thank you for listening.